Thank you for attending our Medicare and HSAs video. This video is not an exhaustive survey of the various components of Medicare. We will touch on the most common considerations and pitfalls when Medicare, Social Security, and HSAs collide. Basic Medicare information can be found at Medicare.gov. In 1965, original Medicare was signed into law. Unfortunately, this means more alphabet soup to serve up. We apologize in advance. Be sure to consult a professional tax advisor, as this presentation should not be considered tax or investment advice. Original Medicare consists of Parts A and B. Part A can be understood as hospital insurance to cover the most serious health conditions that require overnight stays in a hospital. Medicare Part B covers the more routine doctor office visits and other categories like lab work and therapy. Medicare Part C is also referred to as Medicare Advantage. Part C plans are administered by private insurance plans and usually include a broad range of preventative services and value-added programs. Part D plans are for prescription drug plans, which are also administered by the private sector. Finally, so-called Medigap plans are another popular product. These plans are supplemental plans that insure against high out-of-pocket exposure. It is important to note that Medigap plans are not Medicare coverage. You must be enrolled in Original Medicare to purchase a supplemental plan. This explains why you can use HSA funds to pay Medicare Advantage premiums, but not Medigap premiums. Over 50% of Americans start to collect Social Security before they reach the age of 65. If you own an HSA and started to receive federal retirement benefits before 65, you may not contribute to an HSA, nor are you allowed to accept contributions from your employer. You can waive Part B coverage. It probably makes sense to do so if you remain enrolled in your company's medical plan to avoid the extra premium. You cannot waive Part A coverage if you are collecting Social Security or railroad retirement benefits. Let's consider an employee who is still working and not collecting any federal retirement benefit. She's turning 65 soon. She is also enrolled in a large employer-sponsored health plan. Large, in this context, is defined as 20 or more covered members. She can delay enrolling in Medicare Parts A and B and continue to make HSA contributions because she is still covered by a qualified high-deductible health plan. What happens if the same employee works at a company with a small plan defined as fewer than 20 covered members? Federal law dictates that Medicare is the primary payer. If she is not collecting federal retirement benefits, she will need to enroll during her initial enrollment period to avoid penalties. Her initial enrollment period comprises the 3 months before her birthday month, and the 3 months following her birthday month. Please note, although Medicare is primary coverage for small group plans, most insurers require enrollment in Medicare for employees in small group plans. While federal law does not require working seniors to enroll in Medicare, most insurance companies will mandate this in the small plan market. Let's revisit our example where our sample employee is enrolled in a group plan with 20 or more employees. As noted before, she continues to contribute to her HSA because she delays Medicare enrollment and is not collecting Social Security. If she elects to retire after a year or two, she should consider Medicare's 6-month look-back rule to avoid penalties and administrative hassle. Medicare coverage is retroactive for the 6 months preceding Medicare enrollment, but not before an enrollee's 65th birthday. It is very important that she discontinue HSA contributions at least 6 months prior to the special enrollment to avoid penalties. For example, if she is anticipating retiring in September, she may wish to discontinue HSA contributions in February to be extra safe. This is one of the more frustrating aspects of navigating Medicare with an HSA. However, those extra years of HSA contributions combined with practical education will certainly benefit her. Now, let's take a minute to discuss prescription drug coverage as it relates to Medicare, company-sponsored insurance, and HSA status. Medicare Part D is Medicare's prescription drug program. It is not administered by the federal government, but rather private insurance companies. Prescription drug coverage is a little different as it relates to HSA contributions after the age of 65. You can only enroll in Medicare Part D once you're enrolled in Parts A and B. If you delay enrollment in Part D, you must have what's called Medicare Creditable Coverage, or MCC, after your 65th birthday to avoid future penalties. MCC simply means that your prescription drug coverage is at least as rich as Part D. We end this video with a few comments on penalties. It is important to understand that you could face penalties if you are not proactive and informed about the Medicare enrollment rules. Penalties for Part B delayed enrollment can be more significant. In many cases, it makes more sense to enroll on time and discontinue HSA contributions. In some cases, it may still make sense to absorb a Part D penalty. It will depend on several fundamental assumptions, such as HSA contributions after the age of 65, expected growth of the account, particularly if funds are invested, and level of penalty being assigned. Investment and tax professionals are well-versed in many of the more nuanced considerations. Finally, employees do not need to inform the government if they want to delay any coverage. Those who delay coverage need to provide proof of health and drug coverage during the period of delay to avoid penalties. Thank you for joining this video on HSAs and Medicare.